Hello, I'm Natasha Kavanagh for Dubai Life TV. I'm here with Dr. Tarek Abuzakuk, who's the Chief in Orthopedic Care here at the American Hospital. Dr. Abuzakuk,
hello, how are
nice to meet you.
Good to see you.
Could you tell me a bit about the orthopedic speciality?
Orthopedic specialty is a wide spectrum of services. If you look at the literature, for instance, you find that 60% of what comes through to the ER or the emergency room are musculoskeletal injuries. That include fractures, sprains. So here at the American Hospital, we tend to look after this sort of patients because it's very, very important. It's obviously quite a common injuries. There is two types of looking after orthopedic problems. There is the acute side of it, which is the fractures, the trauma, and there is the elective side of it, which is the patients with arthritis or long-standing problems, which can happen both in adults and young people.
So after surgery, you guys provide all of the aftercare in a rehab clinic?
Of course. I mean, for the trauma, usually they come in, they're admitted on the day of the surgery, and then they'll have their operations. They'll probably stay overnight or go the next day. For joint replacement, usually the patients will come in on the day again, have their surgery, and then depending on whether it's one joint or two joints, commonly their knees, they usually stay for about 10 days if they have bilateral knees. But the program for them here is fantastic because the physio will see them twice a day. They'll get them out the next day after surgery. They'll make sure that they walk the second day after the operation. And they'll get two visits from the physiotherapy throughout their stay in the hospital, and the staff are well aware of the protocols and how to deal with these patients, and all our patients, they leave the hospitals are able to walk, able to do the stairs and bend their knees well prior to discharge.
So the population is quite young here in the UAE. Do you get many sports related injuries?
We do indeed. As you know, most of these young adults, they have outdoor sports, football, kiting, jumping. They do all sorts of sports. And we receive here at the American Hospital all sorts of injuries, cruciate ligament damage to the knee, cartilage damage. All that is being dealt with here by myself. And we see, as we said, the sports injuries is a wide spectrum, and we do a lot of arthroscopies to the ankle and to the knee, to deal with most of the problems and injuries.
What advice would you give to teenagers for looking after their joints to prevent future disease and injury?
I think that's what we keep telling all whoever comes to the clinic, and I'll try and pass this message to the public, is to for whoever wants to pursue either the career or wants to play sport has to obviously look after the joints. Make sure that if they are training, to be trained under supervision. Make sure to warm up properly before they go into their games. And that's, there are simple measures that can be done to prevent injuries, and try and avoid being over enthusiastic or overzealous to try and do things. I think as long as they're measured and under supervision, they should be all fine.
Okay, very good. Dr. Abuzakuk, it's been a pleasure to be in here talking to you today in the American Hospital. Thank you.
Thank you.